Intel technology is enabling more people in more places to access the medical care they need quickly and easily. Whether it is getting care where it is convenient, accessing medical expertise in a rural location, or ensuring an ambulance is routed to the hospital that is best positioned to effectively treat the patient, medical devices based on Intel architecture help make it possible. In 2008, an estimated $2.3 trillion was spent on healthcare in the United States. Technology-enabled health applications can help bring that cost down and bring more rapid clinical decision-making closer to the patient. What if technology could be used to deliver a virtual physician's exam? Instead of spending hours scheduling an appointment and traveling to the doctor's office, a patient could go to a self-contained medical station where he could be seen immediately. An electronic triage would begin the interaction, including the measurement of vital signs and connecting to a doctor through the video conferencing application. The doctor would have access to medical records. He would be able to see the patient, ask additional questions, and utilize a variety of tools within the medical station to assist in a diagnosis. Non-urgent conditions could be treated before they get worse, lowering the cost of healthcare and making it more convenient. Millions of people in the world are without adequate access to healthcare. For this population, getting an earlier, accurate diagnosis and treatment plan is critical, with far-reaching consequences. That's why K2 Technologies Solutions developed the Cytosite, which runs on an Intel embedded processor. This device helps doctors quickly diagnose ailments. A technician takes a blood sample and scans it using a camera attached to a microscope. Images can then be sent via the web to pathologists who are many miles away at an urban health center. Communicating vital information prior to an ambulance arrival and routing the ambulance to the hospital best prepared to deliver care makes getting quality care easier. A patient has a medical emergency.
911, what is your emergency?
Hello? Yes, we need an ambulance. I think my father is having a heart attack. He's 61, 7138 North 20th Street, Scottsdale. Please hurry.
Emergency medical services arrive. They begin to gather vital signs and stabilize the patient. They receive patient medical history on their mobile device via the vehicle-mounted communications center. The EMT continues evaluating the patient, while at a nearby hospital, the clinician observing the situation recognizes the patient is going into shock and instructs the EMT on an appropriate treatment.
The EKG confirms anterior wall infarction with a large area of myocardium affected. Route the patient to Mercy Hospital, where they have a cath lab, and an interventional cardiologist will be on standby for an angiogram.
Ready? 1, 2, 3.
The EMTs continue to stabilize the patient. While en route, data continues to be transmitted via the communications center. The doctor instructs the EMTs. While in transit, remote lab results are transmitted. The ambulance arrives at the hospital. Patient data is added to his electronic medical record, removing the need for duplicate data entry and decreasing reliance on verbal accounts. Incident to cath lab time is minimized, thus reducing permanent heart wall damage. Intel-based solutions play a key role in enabling better, faster medical decisions. Imagine how extending technology into healthcare could make a difference in your life.